Up to 7,000 cases a day. That is what new provincial modelling shows could be in store for Ontario. And even that is optimistic. This as Premier Ford faces mounting criticism he's cherry-picking which health experts he's listening to. But first, the numbers and the grim scenario that is being painted for this province.
Under the 5% growth rate before the end of December, we were between 6,000 and 7,000 cases a day.
But health officials acknowledge in the last 3 days, growth has been at 6%. So 7,000 cases a day could in fact be a low estimate. The consequences on the health system are dire. Modeling shows even under best case scenarios, ICU capacity will break the 150-bed threshold within 2 weeks. That means surgeries will have to be cancelled. There have been 71 deaths in long-term care homes in the past 7 days. That number is expected to continue to rise.
I do not believe that there's a way that the cases will change without action. If we continue on with the current level of restrictions, I would not expect to see any deviation from the current results. You'd continue to see growth.
It is alarming, and we want your attention on this matter.
And yet, the province's chief medical officer of health would not commit to increasing restrictions. However, he said he would if he had to.
This challenge is not insurmountable.
Today, the Premier again emphasized the importance of not going into lockdown.
How can you measure the depression, the mental health of businesses and the owners when all of a sudden they go belly up? They put everything they have in their lives into their small business.
The Premier was on the defensive about what advice he is or is not taking from medical experts. He's faced a lot of criticism for his color-coded pandemic framework that many health experts say has set the threshold too high before increased restrictions kick in. The Toronto Star is reporting Public Health Ontario says the benchmark is 4 times higher than it recommended.
Well, that is just totally inaccurate, and I'm a little disappointed on that note, but that's one doctor's perspective.
But there are questions about how much the Premier has relied on public health input as well. On November 3rd, he said he consulted with medical officers of health.
This framework was developed in consultation with the Chief Medical Officer of Health, the Public Health Measures Table, local medical officers of health, and other health system experts.
But a source tells CityNews Toronto Public Health did not endorse the final version. In fact, the source says, like other public health units, Toronto's received the final version just before it was released. Now, there's some conflicting messaging going on here. Dr. Brown, who sits on the science advisory table, acknowledged if the goal is to reduce cases and the impact on the health system, greater restrictions need to be put in place. The Chief Medical Officer of Health is taking a wait-and-see attitude, while the Premier is emphasizing the need to keep businesses open. One further note, the projections presented today put Ontario at higher levels than European jurisdictions, which are under lockdown.